Students, welcome to lecture 25 in biopharmaceutics, and we are discussing pharmacokinetics of intravenous infusions chapter. And in that, we are discussing a series of lectures, and we already discussed in previous lecture what are intravenous infusions. So in this lecture, we are continuing the same topic, and we will discuss in further detail about intravenous infusions. Outline for today's lecture. Um, First of all, a brief recall of intravenous infusions, and then pharmacokinetics of intravenous infusions will be focused upon. And in today's lecture, we will specifically talk about the steady state level and the steady state level concentration, how the concentration at the steady state level can be calculated, and what are the factors which are affecting the steady state level. Then we will also discuss another very important parameter, which is the exponential decline of plasma drug concentrations in case of intravenous infusions, in contrast to the multiple dosage regimen steady state levels attained. Steady state level which are achieved during the multiple dosage regimen of oral administration. So what is the basic difference between the uh, exponential decline of plasma drug concentration in case of intravenous infusion steady state levels and in case of steady state levels which are achieved by multiple dosage regimens of oral administrations. So in today's lecture, we are basically, in short, focusing on steady state and the various factors associated with the steady state. So intravenous infusions, we already discussed about the description of intravenous infusions. What are intravenous infusions? What are their purposes? So if we just take it into parts. So first of all, intravenous infusion is the slow drip of medication into vein. And as we often say whenever we are discussing about intravenous infusions, that intravenous infusions is by intravenous infusions actually we actually mean that drug is being administered in low quantities at a slow rate, uh, as compared to or in contrast to the intravenous bolus administration, which occurs or happens in just minutes or seconds, and the drug is delivered. Rather than that, intravenous infusions are delivering drug very slowly in low quantities and directly into the vein, though that's why it is part of intravenous administration. Then the next part, we can see that over a set period of time, always it is administered over a set period of time. Like we see in case of intravenous bolus administration, that happens in seconds, and the drug is administered directly or delivered directly to the patient into their veins. In this case, usually there is a set period of time, and like for example, the intravenous infusion might be continued for half an hour, 1 hour, 1.5 hour. So that depends at what kind of drug or what is the purpose of the drug which is being administered through intravenous infusion. And similarly, at a constant zero rate, and I already discussed or about the constant or the zero order kinetics. Whenever we say that this kinetics is following zero order rate, what does it mean is that the kinetics or of that specific process, whatever process we are talking about, like here we are talking about the absorption process. So that process is doesn't depend upon the drug's concentration or amount of the drug within the body or at that point of absorption or at the site of absorption, because here we can see that drug is being directly delivered into the veins and at a very constant and slow pace, and irrespective of the fact that how much quantity of the drug is present in the circulation. So this kind of kinetics is called zero order kinetics, which is independent of the fact that how much amount or concentration of the drug is present there, and to deliver a constant therapy. So by all these things, what we actually want is that to deliver a constant therapy, which is being so what do we mean by a constant therapy? Constant therapy is delivery of the medication or administration of the medication at a low in low quantities at a slow rate at a constant zero rate, so that the constant therapy is maintained and the patient is actually getting the drug at a desirable concentration. And later we will talk about the desirable concentration. What we actually mean by that? That is that steady state concentration which we actually want to achieve at the end of the intravenous infusion administration, and then we continue that. So coming to pharmacokinetics of intravenous infusions, one thing is very important to understand about intravenous infusions and their characteristic property of its kinetics. Pharmacokinetics is that always when it would be administered, it will be following zero order kinetics, and I think I have explained already what is zero order kinetics and what is first order kinetics multiple number of times, so I won't repeat that. So now we just simply continue that the distinctive characteristic of pharmacokinetics of intravenous infusions is that whenever they are administered, their input rate is following zero order, while when the drug is infused directly into the systemic blood circulation. However, as far as their elimination is concerned, the drug is following a first order kinetics. It simply means that the elimination process depends upon the concentration of the drug within the systemic circulation. With time, as the concentration of the drug will increase within the systemic circulation or within the body, the elimination rate will be increased proportionally, and this happens in case of first order kinetics, and that's why what we usually see in the curve which we get for intravenous infusions, that in case of intravenous infusion, initially when the drug is being administered from zero, the concentration will increase, and the rate of input will be greater than the rate of output. Rate of output would be lesser because initially would be lesser amount of drug in the concentration. But with the passage of time, as the concentration increases, the rate of output also gradually comes closer and finally equivalent to becomes equivalent to the rate of input, and there is when we get the steady state level. So this was I was talking about. You can see that this is the zero concentration from where the concentration is raising when intravenous infusion is being administered. Plasma level is rising, and it is a clear indication that initially the level will rise because the elimination rate is very lesser and the level is only rising, but slowly and gradually both processes becomes equal, and then when we get the steady state level, and our today's discussion will revolve around the steady state level and what's its importance and significance. So steady state level, a steady state, the rate of drug leaving the body is equal to the rate of drug or infusion rate entering the body. And in previous lecture too, we discussed it that a steady state level would be the that state or that level when the rate of input becomes equal to rate of output. And so when this happens, what happens that at the steady state, the rate of change in the plasma drug concentration becomes zero. There is no change in the concentration, and that is just stable. And here is one thing which I want to clear: the steady state level which is achieved in case of the multiple dosage regimen in case of oral administration and the intravenous infusion, there is a big huge difference. If you recall, the multiple oral dosage regimen and the steady state level which is achieved during that, in that what happens that there is a fluctuation in the concentration of the drug at the peak and the trough levels, and then the average level is that which we call the steady state concentration, but actually the level is fluctuating. And the reason is that drug is being orally administered, and definitely it takes some time to reach again or the level back that concentration again, and then when the elimination dominates till the next dose, usually what happens that the concentration drops a little bit. So there is a fluctuation in case of oral administration, while though that fluctuation is not visible in this case, or you cannot experience in this case in case of intravenous infusion, which is another good thing which adds to intravenous infusion steady state level, the steady state level which is achieved because of intravenous infusions, that your level would be totally stable and would be the same throughout the steady state concentration. That's why intravenous infusion becomes so important to follow or adopt it in case of the drugs which got narrow therapeutic indices like the digoxin or the lithium and gentamicin and all those drugs which may cause toxicity in no time. And mathematically the same thing, that there will be a zero concentration change. You can display it like this. So the change in the amount of drug in the body at any time during the infusion is the rate of input minus the rate of output. So let's suppose before attaining the steady state, if one wants to calculate the change in the drug concentration which is coming, that is very easy to calculate. Rate of input from the rate of input, the rate of output will be minus or subtracted, and that would be equal to the change in the amount of the drug per unit time. So that could be easily calculated, but this is applicable other than the steady state levels. At steady state level, you must be clear that there is no change in the concentration of drug. So as we just discussed, the contrast between the intravenous infusions attained steady state level and the multiple oral dose steady state level. So we discussed that there in that situation it means that in case of multiple oral dose regimen steady state level which is attained in that situation, there is a fluctuation in the concentration, and at the steady state level, the concentration is though constant, average concentration is constant, but that is fluctuating at between the higher and the lower level, depending upon the dose when it is administered and when it is near to be eliminated and the new dose is supposed to be administered. While in case of the intravenous infusion, there is a consistent steady state level, there is no change in the concentration, and that we can see in this curve as well. But another very important thing which is hallmark of or the characteristic property of the steady state levels which are achieved by intravenous infusions, and that's why again I would say that intravenous infusions are preferable whenever the consistent levels are desired to be maintained for constant level, or when the constant therapy is supposed to be given, or whenever the low therapeutic indices drugs are being handled. So intravenous infusion is the most desirable route which is usually followed. So there are various reasons, and now we are discussing one of the another reason, that what happens that in that situation, in means in case of multiple oral dose drugs curve, when steady state level is achieved, it is very difficult to abruptly stop the administration if for example the level is dangerous or the patient has started to experience side effects. So if you stop the level, stop the administration of the drug, it would be very hard that the side effects would subside immediately. While in case of intravenous infusion, the steady state level which is achieved, you can say 2 points A and B. A is the point which is just immediate before the steady state level. Soon after the A point, the steady state level would be achieved. So you can say that A is the steady state level point basically. But B point is just before the steady state level, and you can see that when this is the point where the administration is stopped. So the level drops exponentially immediately. And similarly, when at the level at the point A, which is actually immediately before or in fact the steady state level, when the administration is stopped, again the level drops exponentially immediately. While this doesn't happen in case of multiple oral dose. What it simply means that intravenous infusions are very safe. Whenever the patients are experiencing the side effects, just stop the administration abruptly and the level will drop immediately. And there are chances that the side effects will start to be reversed. And so this is the main property of intravenous infusions, which is quite different than the steady state level, which is achieved through multiple oral dosage regimen. And it has its own significance. It is very controllable and manageable. So in the previous curve, as we have seen, both the points A and B, that whenever that the intravenous administration is stopped, the plasma level concentration decline exponentially. Exponential decline means the first order, following the first order, and the slope is similar in both cases. So it simply means that no matter whether you are stopping the intravenous administration at the steady state level or you are stopping it before that, slope or the curve would be coming in downward direction in the same way. And this equation justifies that, as we can see that the change in concentration, as we know, that is equal to rate of input, as we before discussed, that it can be easily calculated by subtracting the rate of output. This KdB is basically showing the rate of output, which is basically the first order, following the first order from R, which is the rate of infusion. So you can see that how this equation explains this situation, that whenever you stop the intravenous infusion, the level will drop exponentially and the curve would be in the downwards direction, means the concentration or change in the concentration coming would be negative. Concentration would start to decrease immediately. You can easily understand it why, because rate of infusion has been stopped. So now the value which is left behind is definitely negative. That simply shows that curve is declining in the negative direction, in the downwards direction, and the concentration is change in the concentration coming is negative. And in this equation, GB is the amount of drug in the body, while R is this one, is the infusion rate, which is following zero order. K is elimination rate constant, which is following first order. So this is for the output. Plasma concentration at steady state level. So usually it is very desirable to know or to calculate the exact concentration which is at steady state level, and it is usually the desired concentration which you actually want to achieve. A pharmacist actually want to achieve. So they would be setting the infusion rate at a rate that it helps them to achieve that concentration. Anyways, if the previous equation which we just discussed in the previous slide, if we integrate that equation 1 and we substitute the value of dB as a CPVT, which you know is the basic equation for the amount of the drug, that is equal to CPVT. VT shows the volume of distribution, while Cp indicates the plasma concentration. So it generates this equation. Cp is equal to R divided by KVT, 1 minus e raised to power minus kt. K is the elimination rate constant and T is the time which is taken to achieve the steady state level, and Vt is volume of distribution, K is again the elimination rate first order, R is the infusion rate, Cp is the plasma concentration. So as the infusion continues, time t increases. As we know that usually the steady state level is something which you have to achieve at the end of the infusion and then you maintain it. So simply this time is considered the infinite time. Usually the in mathematically, when we are dealing with values, various values, in order to make the derivation of the mathematical process easy, usually the values which are too large or which are usually coming after a sufficiently large time, those are considered infinite. So here we are discussing that as the infusion continues, time t increases. And when time t increases, that becomes infinity. And as you can see that in the previous equation, infinite time was in the e raised to the power minus kt. So such a power of infinity, infinite value would be 0. So that would be automatically 1 minus 0. That would turn into 1 minus 0. And like if you remember what we discussed in that one, e raised to the power minus k t. We discussed this one in the previous equation, 1 minus e raised to the power minus kt. Now, what we are discussing right now is that time is reaching to infinity. So it is becoming 0. This whole value is turning into 0 because the concentration is, the time is increasing with the intravenous infusion. And when we specifically talk about the steady state level, what happens that t becomes infinite, and anything um, whenever e is the power, e reaches or attains to the power of infinite, that total value will turn into simply into 0. That value is not manageable. So 1 minus 0 is simply, this whole thing means 1. So 1 has nothing to do with, so that is totally removed, that value is totally removed, and we are left with in the equation with this value. And this is also called R divided by clearance, because V and Vt is the volume distribution and K is the elimination rate constant, and these two values are also equal to clearance. Clearance is also equal to, as we usually see that the equation of that is also one of the basic equations. Clearance is equal to V D and K. So basically, by using this equation, right, by putting the value of clearance, we get this equation. So steady state concentration is equal to uh, this one or this one. We can use both the equations in order to calculate the steady state concentration at means at steady state level. We can use these both of the equation. Depends whether you are having the clearance value with you or you are having the volume distribution or elimination rate constant value. So mathematically, it takes infinite time to reach true steady state drug concentration. That is the same thing is being repeated again. So what we understand from that equation, which we finally get, in which we were discussing that steady state concentration is equal to either R divided by Vd or K, or it is equal to R divided by clearance. So if the volume of distribution is constant, the time required to reach steady state drug concentration in the plasma is dependent on elimination rate constant of the drug. So if, for example, in that equation, as we know that Vd and clearance, the elimination rate constant were involved. So if, for example, the volume of distribution is constant, one of the parameter is constant and the other is taken, so the steady state concentration is in the plasma is dependent on the elimination rate constant of the drug. So if we elaborate that a little further, because drug elimination is exponential following first order, the plasma drug concentration becomes asymptotic to the theoretical steady state plasma drug concentration, which means that for a zero order elimination process, if the rate of uh, input is greater than the rate of elimination, plasma drug concentration will keep increasing and no steady state level will be reached. And now they are talking about a potentially dangerous situation that will occur when saturation of metabolic processes occurs. As you know that we multiple times discussed that elimination process is following zero order, first order. Now we are saying that it's following zero order. Now this is a situation is actually being discussed, a potentially dangerous situation is being discussed, that if intravenous infusion somehow is maintained above or greater than the elimination process, then what will happen that the concentration will continuously keep increasing. That's why in the previous slide we were saying that if the volume distribution is constant, then the steady state concentration depends upon the elimination rate constant, elimination process, or the rate of elimination. So the same thing is actually being turned into a perspective that if, for example, the concentration is continuously rising, somehow the intravenous infusion or rate of input is managed in such a way that the concentration is constantly rising, then the elimination rate and is not coming equivalent to the input, then a certain potentially dangerous situation might be reached, in which it is also called the saturation kinetic. Metabolic processes and all the enzymes and transporters get saturated, and in that situation what will happen that the concentration will be continuously increasing, and it would be very difficult to achieve the steady state level then. So that would be a potentially dangerous situation which is supposed to be avoided.